This presentation. Dr. Sumit is a professor of ophthalm at RIO PGIMS Rohtak. He's a national level faculty as well as an international level faculty on glaucoma. He has done presentations and workup classes at Singapore and other countries in glaucoma. He is a very versatile surgeon. I can vouch if anybody's want to get operated in Rohtak, he's the man to go for. Besides being a great surgeon, he's also a great friend. And now I want Dr. Sumit to please start his presentation.
Thank you, Dr. Vikram. It's a pleasure to be here amongst you today morning. And I thank Dr. Vikram for conducting this IC on happy patient outcomes. A very important topic for all of us, because all of us want our patients to go happy and satisfied. But what all takes to make it happen, that's what we are here for. So I'll be talking about patient expectations and preoperative counseling. Now, we all know that cataract surgery is the most commonly performed ophthalmic surgery worldwide. It is mostly very safe, but yes, the complications do occur and they do happen. And the patient counseling has all these implications. It has a medico-legal implication also, because you have to explain everything to the patient. It is good for the morale of the patient and ethically justified. So a proper counseling is all what is required. Now, the cataract surgery has evolved from being a vision restoring surgery about a few years back to the eagle vision concept. The patient wants everything in one go. So this is what the patient's expectation is from us. And to ensure happy patient outcome, it all depends on the work profile and the visual demand of the patient. What is the age of the patient? The economic status, very important. Any comorbidity, or the personality types, how the patient is. Now, how does a cataract patient comes to our OPD? He comes to us with either diminution of vision, has some work-related problems like during driving or during reading or during watching something on television. Then they are mostly, sometimes they come to us with as referral patients also by some optometrist who has done their refraction somewhere outside, and they are referred to us from that place also. So these are this is the profile of how the patient comes to us. And now, if the patient is told directly that, yes, you have cataract, his reaction depends upon the age and the stage of the cataract. Now, the age means that if you tell it to a younger patient, less than 30, 35, 40, then it's very hard for him to take that, yes, he has started developing cataract at this stage. Or if you tell it to a person who is already an old patient who is expecting this to happen, so it's very easy to convince him for surgery or to tell him that, yes, this is what is required. And of course, the stage of the cataract, if it is a hard, mature cataract, the vision is almost lost, the patient is much more easily convinced to get it done. While if the patient's vision is almost okay and it has just started, so it's quite challenging to make him understand that, yes, you require cataract surgery because your work is being hampered. Now, what are the expectations of the patient? The expectation is to have a clear vision, so that he can perform the near, intermediate, and distant activities with ease. And he's comfortable during nighttime and can perform the day-to-day activities easily. So this is all the patient wants, which is basically all what we want also. And but as we all know, cataract surgery is not a magic. So why is this counseling important? Counseling is important because it respects the patient's autonomy to make a decision, to be convinced that, yes, this is what I require. He has the right to make the correct decision. So it is your responsibility to tell him about everything that is involved in a cataract surgery. Cataract surgery might be a routine procedure for you, but for the patient, it is very, very important because it's his eye and it is going to be operated only once, most of the times. So you have to weigh the risk to benefit ratio if there is some risk factors involved. Then you have to allay the patient's fear. The counseling is important to allay the patient's fear, and it ensures a realistic realistic expectations of the patient. So a very important part of your cataract surgery is the counseling. Now, to counsel a patient, first of all, you have to convince yourself what is the best treatment option available for the patient, keeping in mind his eye condition, the age of the patient, the pocket of the patient, very important, and his expectations. You have to discuss various options and expected outcomes. Be very clear and realistic about your procedures, about his expectations, and you have to be very clear about it. And discuss the potential risk factors. If it's a complicated case, you have to tell everything. You don't just promise the moon to him. You just tell him that these are the risk factors involved in the surgery, and these can be the limitations. What is covered under counseling is that what does the cataract surgery involve? How are we going to, for the procedure, whether we are going for a manual or a phaco, whether it's, what is the pre-operative assessment, what is the type of the anesthesia that we would be using, maybe it is a general anesthesia, topical, or a periorbital block, which surgery is being offered, is it normal phaco or femto or the ECC, whatever. Then post-operative care and duration is very important. The patient wants to know when can I get back to my day-to-day work. So that is very important that you have to tell him that this is the time that you would require for the recovery. And then what benefit does it do? It creates a less anxiety in patients. The patient is more self-confident. He has a better relationship with you once you talk to the patient. You just counsel him. Then it regains its emotional balance. There is increased assertiveness by the patient also. Stress is relieved. And he's able to set the boundaries that, yes, this is as far as I can go. And there is no trauma after the surgery has been done. So this all helps the patient to be more confident and more sure about himself that what he wants. Now, what more you can cover besides the type of the surgery? You can cover the type of the IOLs that you would be using, whether the premium IOLs or the normal ones. What is the expected outcome of them? What is the recovery part? And most importantly, what is the cost of the surgery? Now, to assess, to have a healthy or a good outcome, these are the pre-operative assessments that you need to perform. Like, just don't look at the cataract part, look at the other things also, like lid hygiene. What is the cornea status, whether there is any opacity which might hinder the vision later on. You have to tell it beforehand. All has to be seen on a slit lamp. What is the AC reaction? What is the pupillary reflex, whether there is any REPD or a subtle reaction which is out of normal? What is the grade of the cataract? What is the vitreous? Are there any vitreous problems? I've seen people with asteroid hyalosis coming later on and with visual disturbances. So we have to tell them beforehand that, yes, this is the problem and you might have some problem later on. The proper retinal assessment is very important. And if you can get an OCT done beforehand, that would help. If it is not there, but your clinical judgment should be there. And the macular function. The simple tests are there which can be done. The type of surgery that what we are performing nowadays are phaco, femto, SICS, ECC will be discussed later on. The type of IOLs, monofocal or multifocals, hydrophilic, hydrophobic, aspheric or spheric, plain or toric. Special situations like phakic, scleral fixated, and CTR, they have to be explained to the patient. Now, who is not an ideal candidate for premium IOLs? This is very important. We are very, premium IOLs bring a lot to our practice, and we are ready to offer them to anyone who comes to us. But those people who strictly do not want to wear spectacles, they are not ideal candidates. Yes, you have confidence in yourself, you can perform the best surgery in there, but still there are people who are not satisfied with the outcome. So, who strictly do not want any spectacles, they are unwilling to adapt, they have unrealistic expectations, and they have abnormally long or short eyes, then we have to be very careful in prescribing premium IOLs or the charges accordingly. What is the expected outcome? It depends upon the preoperative condition of the patient. If the patient has some problem in the retina, yes, the expected outcome would not be there. What is the comorbidity? Are they suffering from any condition like diabetes, AMD? And the type of the surgery which has been performed also has an expected outcome. It affects the outcome. The common post-operative problems have to be explained to the patient in his language, that yes, there can be slight pain after surgery, there will be some redness, there can be. There can be some itching, foreign body sensation, and watering. These are the most common complaints that the patient comes to us or calls us later on, sir. आँख में रड़क हो रही है, पानी आ रहा है. So this is what we need to explain. This is common, this is normal. Patient is much more confident about himself. Then post-operative care, you have to advise about proper hygiene and restrictions. Be patient with the patient's problems. Reassure him and be willing to make the change because it's his IOL, and just advise him that yes, all is well, don't worry about it. These pamphlets, yes, definitely do help. If you have them, that is very good for the patient. So my carry-home message would be that proper counseling plays a very important role in happy patient outcomes. Tailor the counseling according to the individual needs and his expectations. Be very realistic and under-promise and over-deliver. You will have a very, very happy patient and he will be eternally grateful to you. Thank you so much.
Thank you, Dr. Sumit. That was a good overview of the patient's expectations. I'll just like to add, yeah, Dr. Sobha, you please sit. Till Dr. Soumya takes the dais, there are few things I'd like just to add to it.
Yes.
What Sumit properly mentioned, that patient counseling, pre-operative is important. We do have counselors in a setup who counsel the patients, but what he actually said, the first counseling should be done by the doctor, because howsoever learned your counselor may be, but he's not technically, clinically that strong. So a doctor giving the first counseling is really important. So one more important thing I'll add from my personal experience, the first reaction to a diagnosis, especially for the young patients, 35, 40 years, who come with PSC, they have some vision problems. And then all of a sudden you tell them, yes, you have a cataract. If you just straightway go and tell them it's a PSC and you'll have to get it operated, believe me, 99% of those patients will never come back to you for surgery. Tell them, boss, you have a cataract if you want to retain your patient. Yes, you can wait for some time, but slowly it's going to progress. Let's see how much time it's going to take. Because I have personally experienced those patients whom I would say, boss, you have a cataract, get it operated, I never saw them again. And those who had been seen by someone else prior, and he had told them the same language I told, ki, boss, you get it operated, they were getting operated for me. So I inculcated that practice, and now, whenever a young patient is there with a cataract, I say, yes, you have a cataract, but I hope it's going to take some time to progress. In the meantime, there's nothing better than a lens given by a God. Let's try and see it, and in the meantime, troubles you more you come. And those patients come back to me for surgery even after 6 years, 10 years. So this is how the patient are retained, and then they are satisfied with you. That is, I would put it like a counseling or pre-operative assessment or diagnosing first time the cataract. And one more thing, as I told about pre-operative AMDs or asteroid hallucinosis, I like to add a point, Sumit, here. Posterior polar cataracts, I always do tell my patients, see, this is a posterior polar cataract. This is one of the worst type of cataracts. We handle most of them very nicely, but in few odd cases, you can have a nucleus drop. And if that happens, then I'm already pre-warning you. I'm just not responsible for it. I'll guide you. I'll get it operated for you. But then you'll have to handle the cost yourself. I always tell that point very clearly. And I tell you that removes a lot of burden from my mind. I'm operating more freely and we really get good results. What do you say, Sumit?
Yes.
Amit?
Yes.
So posterior polar cataract, I mean, you have to be very careful. You have to counsel the patient pre-operatively. My patient, if he has a posterior polar cataract, I tell him clearly, I might not be able to put the lens in the same sitting. If your lens can drop down, I might need a second, you might have to undergo a second surgery. I might not use the lens which is promised. I'll set on the table which lens is best for you and I'm going to utilize it. So I explain all these things, I write on the file and I take the patient's signature also. And so the patient and the attender has to sign the consent and there's no harm. You tell him that doesn't happen, the chances are rare, but if it happens, this is the treatment protocol I'm going to follow and I want to make you aware, and the acceptance is very high after that.